Hello, I'm Dr. Gail Lowenstein. I am a Western-trained physician, and I'm also trained in holistic medicine. And I'm here today to interview Dr. Garry D'Brant. Dr. Garry D'Brant will be speaking at our next CAM group. CAM stands for Complementary and Alternative Medicine. I started this group in 2002 when I was first studying holistic and complementary and alternative medicine. I now want to introduce Dr. Garry D'Brant. Welcome.
Thank you. Yeah.
Dr. D'Brant has many different degrees. It's really quite fascinating. He is a New York State licensed chiropractor. He is also a New York State certified dietitian and nutritionist. He is also a diplomat of the American Chiropractic Board of Nutrition, a certified traditional naturopath, and a licensed clinical social worker in New York State. Wow, you have really continued to study and learn and get many different degrees.
Yes, it feels like learning is a lifetime pursuit for me.
It totally is. And you'll be speaking on March 15th at the Jewish Community Center on adrenal fatigue. What is adrenal fatigue?
Well, the adrenals are such an important gland in our organ and part of the endocrine system. So when they get fatigued, when they get exhausted, they stop doing their job in the body. So adrenal fatigue is when the glands really give up the ghost, so to speak. They have done everything that they can to try to keep homeostasis or balance in the body, and they lose their ability to regulate the internal workings of the body. And they go into fatigue first, and then they go into a more exacerbated state, a more advanced state, which is called adrenal exhaustion. And there are actually 3 different levels of that: first, second, and third level of adrenal exhaustion. Anyone who has that or is suffering from adrenal exhaustion will have a variety of things that they might consider to be symptoms, some of which will not immediately make them think of their adrenal glands, because the adrenals have so much to do with the workings of the body that literally it could virtually come from any system, and it very well may have a hidden or background cause of adrenal exhaustion behind it.
Well, I never learned about adrenal exhaustion when I was in medical school. Is this something that physicians know about?
No, not really. I didn't learn about it in chiropractic college either. It's just one of those places that I think has been sort of going under the radar for quite a long time. I kind of think the fascination in the medical community has been with thyroid problems, and that thyroid gland is obviously part of the endocrine system as well. But I tend to think of the adrenals as sort of the lost stepchild of the endocrine system. Nobody's been paying a lot of attention to them.
So how would someone know if they have adrenal fatigue?
It's a good question. They might go to their medical doctor and get a standard blood test, but it would probably not necessarily show what you would need to see here. The blood test would be measuring, as we all know, the serum. And the problem with measuring serum for something like a hormone is that hormones come in 2 different types basically in the body: the free or unbound portion and the bound one that is usually bound with protein. The free and unbound part of adrenal hormones, things like cortisol, dehydroepiandrosterone, DHEA for short, are about 2 to 5% of the volume of the hormones, and about 95 to 97% is the bound one in protein. The problem with trying to measure it through the blood is that it gets filtered through the salivary glands, and the protein-bound hormones are too big. So they don't make it through the salivary glands into the blood, so it's not an efficient measurement tool for measuring. This way we would do it would be to measure it through saliva. And that's the preferred way to do it, because we get 4 different measurements through the course of a day, so we get to see the rhythm of hormones in the body, which is much more specific and much more timely to understand what's actually going on with these hormones as they interact and move through your daily experience. So saliva is the way to do it.
What could be some of the symptoms of adrenal fatigue?
God, do we have an hour? The symptoms could range from anything. We could be talking about anxiety, could be talking about mood disorders of all different types, depression, Could be talking about anything that would involve inflammation in any of its forms. That's, again, as you know, virtually everything in the body could be involved in. It could have an inflammatory component. Digestive disorders, autoimmune diseases, really very typical in autoimmune diseases to see adrenal dysfunction. We could have headaches, could have pain patterns, particularly neck pain or shoulder pain. You could have sleep disorders. For women who are having either PMS could be a possibility, or if they're closer to menopause, they could have very difficult entrance to perimenopause and in menopause. A classic one is when you have the woman who's gone through menopause already and is 10 years, 5 to 10 years past it, and is having worse hot flashes than when she was in menopause, and can't understand it because she's already been done with menopause for 5 or 10 years, and actually symptoms are worse now. Thyroid disorders could be secondary to adrenal problems, so there could be weight issues. There could be a tendency to be really cold. You could have thinning of the eyebrows and things that we would think of as thyroid kinds of problems, but are actually adrenal problems first and thyroid secondary. The list goes on and on and on. We really could talk about it for another half an hour and probably not cover everything. Allergies are another very large part of it.
So it seems that any and all chronic illnesses can have their root in adrenal fatigue.
That's absolutely correct. I've worked with some people who would be considered unhelpable in our sort of modern way of looking at things. People with Parkinson's, MS, other autoimmune diseases, and they've responded better than they have through conventional medicine by working on reestablishing adrenal health and vitality.
Is our frantic, crazy type of lifestyle making us more likely to get adrenal fatigue?
Yes, without a question of a doubt. The frantic, crazy lifestyle, another way to say that would be we're all under increasingly heavier amounts of stress. And stress is probably something that we don't think about so much anymore because everyone will hear people, well, I'm stressed out, or I have a lot of stress, or whatever, but we toss those words around like they're nothing. I think that's more than nothing. Stress happens on a lot of levels, crazy, frantic pace, environmental stresses that are happening in our bodies, foods that we're putting into our bodies that are causing inflammatory responses, wheat allergies, gluten intolerances, things like that, electromagnetic pollution that causes stress in the body, not enough sleep because we're so active during the day that we have a hard time shutting off our bodies, and so we don't get into REM sleep, and that causes us to be adrenally deficient because the adrenals are constantly trying to solidify what is a ever-changing internal landscape. So yes, stress and the pace of life on many levels is exactly what I think is at the root of this.
So once you've identified that someone has adrenal fatigue, what do you do about it?
There's a variety of things to do. The first, of course, is to get it really looked at and to understand exactly at what level it's happening at. There are a variety of supplements that you can work with, lifestyle changes. I say lifestyle because to me, most health absolutely, as a bottom line, involves changing and looking at what we're doing in our lifestyle. What I think is a problem here is that people might think that it's okay to just go to the store and get vitamin C and get an herb that says adrenals on it. It's important to know exactly what level of fatigue or exhaustion you're at because the symptoms not only will change, but also the treatment will change depending on what needs to happen.
Well, what I got from what you just said is you said you need to know what level of fatigue you're in. Now, when you say that, we're not talking about the fatigue that we're feeling. You're talking about the fatigue of your adrenal gland.
That's correct.
And we may not know how fatigued our adrenal gland really is. You need to do your saliva tests in order to know that for sure.
Absolutely.
So it's not directly related to whether we actually feel fatigued.
No, in fact, the opposite might be true because as we produce more adrenaline and cortisol, for a while, when a person is experiencing a load of those, we're actually going to feel better. We're actually going to be what I would call stress addicts, people who thrive on getting more done. The chronic, and I love this word because I'd like to erase it from the human language, the multitasker. The person who's doing 6, 7 things at one time and thinks that they can do them all, and can for a while, because the body's adrenal glands will do what they're supposed to do, help us adapt. The problem is after a while, we run out of fuel in the tank. The adrenals literally begin to collapse on themselves.
Thank you for tuning in.